Now another form of previa is something called a vasoprevia. This occurs when there's velamentous cord insertion of the umbilical cord into the lower uterine segment, and then those velamentous vessels travel beneath the membrane to the placenta crossing the cervix. Because these are fetal vessels and they're unprotected by membranes, this is associated with a high perinatal mortality. On ultrasound, we'll see vessels overlying the cervix, and we can confirm the vascularity with color and spectral Doppler. The color showing where the flow is, the spectral Doppler confirming that these are umbilical vessels belonging to the fetus. So here's a transvaginal scan of the lower uterine segment on a patient. The placenta was not near the cervix, but look as we pass this clip over the cervix. You can see on the clip the internal cervical canal, and you can see just over the os a vessel crossing over from one side of the cervix to the other, right over the internal os. With spectral Doppler insonation of this vessel, we see that it has an umbilical artery waveform. This is the fetal umbilical artery, and you can see how dangerous this could be. If the cervix were to open and tear this vessel, the fetus would suffer severe bleeding. Another reason for an emergency ultrasound in the second or third trimester is if a patient presents with pain. Pain can result from abruption, from cervical changes, or if there's a uterine incarceration. When evaluating the cervix in pregnancy, it's important to see the entire length of the cervix, including the internal os. The normal cervix prior to the third trimester should measure more than 3 centimeters, and the internal cervical os should be closed. We measure the length of the cervix on a sagittal view that shows the cervical canal. The internal os, as I said, must be visible, and we measure the closed portion of the cervix from the amniotic fluid to the external os along the cervical canal. Transabdominal scans are often successful at measuring the cervix, but if they're not successful, we can move on to a transvaginal scan or to a translabial scan if a transvaginal scan is contraindicated. Here's a patient with a transabdominal scan at 20 weeks gestation where we got a good look at the cervix. You can see that the walls of the cervix are marked by the yellow arrows, and the cervical canal is marked by the calipers, showing that its length is 5.3 centimeters, well above the normal of 3 centimeters. There are pitfalls to scanning the cervix transabdominally. One is that fetal parts may overlie the cervix, obscuring it. Another is a lower uterine segment contraction. Another is an overly full maternal bladder. And lastly, sometimes maternal body habitus prevents our seeing the entire cervix well. Here's a transabdominal scan in a patient with a lower uterine segment contraction. We know that the cervix is down here behind the bladder, but we have no idea where the internal cervical os is because of the contraction of the lower uterine segment, such that the anterior and posterior walls of the cervix are abutting each other and touching each other, preventing us from seeing the amniotic fluid against the internal os. If we wait a little while, though, this contraction will begin to resolve, and we will then be able to see the entire cervix and separate it from the contraction. In this patient, the bladder was overly full. Because the bladder was full, there was apposition of the anterior and posterior walls of the uterus, making the cervix look abnormally long. You can see that part of this is the cervix and part of this are the two walls of the uterus compressing against each other. When we empty the bladder, now we have a better view of the cervix. We can see the entire length of the cervix. It now measures 3.9 centimeters. The transvaginal scan is usually diagnostic for evaluating the cervix in pregnancy. We do, though, need to be careful because there is risk of bleeding if the patient has a placenta previa, and there's also risk of introducing infection if the patient has ruptured membranes. Here's a patient in whom we could not see the cervix transabdominally. The patient had cramping and pain, and they did want to know the status of the cervix, but the fetal head was obscuring the cervix. We know it's down here someplace, but we don't know whether it's open or closed. Transvaginal scan was immediately performed, And you can see now that the cervix was open. There is opening of the internal os with bulging of membranes into the cervical canal. And here we've measured the residual cervical length to be 1.0 centimeters. When the cervix shortens prior to the late third trimester, there's increased risk for preterm delivery. The normal cervical length should be more than 3 centimeters, so if it's less than 3 centimeters, it's important to note that. There's an increased risk of preterm delivery that depends on how early the premature cervical shortening is and how much. So there's particularly increased risk for preterm delivery if the shortening occurs before 24 weeks gestation or if it's shorter than 2.5 centimeters. Here's a patient with a shortened cervix. This is a transvaginal scan showing the cervix. Here's the cervical canal marked with calipers to give a length of 2.1 centimeters. Sometimes the internal os will open, but the external os will remain closed, and what you'll have is you'll have a funnel-shaped protrusion of membranes into the upper cervical canal. This is a diagram showing that. When we have this, we measure the residual length of the cervix from the amniotic space to the external cervical os, as you can see here. And it's the residual closed portion of the cervix that helps us know what the risk is of preterm delivery. So here's a patient with an open internal os with funneling, and the residual cervical length has been measured. You can see we have a transvaginal probe in position. Here's the external os. The level of the internal os is up here, but there is funneling and opening, funneling into the cervical canal, leaving a residual cervical length of only 1.0 centimeters. Overall, the risk of preterm delivery is related to the length of the closed portion of the cervix. It's not related to the width of the funneling. The shorter the cervix, the greater the risk. Here's some information about 24-week gestations. If the cervical length is less than 2 at 24 weeks gestation, the likelihood of preterm delivery is very high. If it measures 2 to 2.5, there's a moderate risk of preterm delivery. And if it's 2.5 to 3, only a mildly increased risk of preterm delivery. So here's a 20-week gestation. You can see that there's funneling of fluid into the upper portion of the cervical canal, and the residual cervical length is 1.7 centimeters. At this gestational age, that means there is a high chance that this fetus will be delivered prematurely. In some cases, the cervix changes minute to minute, and thus we need to look at the cervix for more than just a single measurement. This has sometimes been called a dynamic cervix. When we see this, we do want to measure the cervix at its shortest measurement. The degree of funneling will change, the length may change, but the risk of preterm delivery is related to the shortest measurement of the residual closed portion of the cervix. So here's a patient with a dynamic cervix at 26 weeks gestation. These are transvaginal scans done close to each other. You can see initially we can see a portion of the cervix is closed and a portion is open, and the residual cervical length is almost 1.4 centimeters. But just a few minutes later, the funneling has widened significantly, and the residual cervical length is now only 0.9 centimeters, much smaller than it was just a few minutes before. You also can assess for a dynamic cervix by putting fundal pressure on the uterus to try to see if the cervix will open from that pressure. This may lead to shortening of the cervix as well as an increase in the amount of funneling. Again, the overall risk of preterm delivery after fundal pressure is related to the shortest measurement that you get from the residual cervical length. So here's a patient who had a transvaginal scan for suspected cervical incompetence. Initially, the cervix measured normal at 3.3 centimeters, but with fundal pressure, we could see the cervix begin to shorten. And sure enough, after some fundal pressure, the cervix was now short at 2.1 centimeters.